nice.
Yeah, it's good. So good afternoon. First and foremost, I want to take a moment to thank MatTech Life Sciences for hosting all of us today. This is a pretty impressive place, and the work done here to assist in the fight against COVID-19 and many, many other maladies is incredibly important, not just for Massachusetts, but for states and communities nationwide. I'd also like to thank Senate President Karen Spilka for joining us today and for her continued work on behalf of her district and the Commonwealth during this public health emergency. I'd also like to just give a quick update on testing and hospitalization. Yesterday we conducted and processed 6,339 tests, which brings our total to just under 400,000. We believe the number of tests that were conducted was a little lower because people probably didn't go out and get tested on Mother's Day. Of those over 6,000 tests that were processed, 669 were confirmed positive, or about 12%. That's certainly within the range that we've been seeing for the past week or so, and is certainly, from our point of view, a continued step in the right direction. We continue to have daily conversations with our partners in the healthcare community to monitor hospitalization rates and capacity. The number of cases currently hospitalized remains at about 4% of those who test positive. And while that sustained low rate of hospitalization is promising, we also crossed a sobering and sad threshold yesterday with more than 5,000 individuals who have died here in Massachusetts as a result of COVID-19, and obviously our hearts go out to their friends, to their families, and to their loved ones. We remain, as we've said before, one of the hardest hit states by the COVID-19 pandemic, and we still have a lot to do and a way to go to contain the infection rate and reduce the number of people who need serious hospital care. And obviously, we continue to monitor information daily on ongoing trends to help inform our next steps. And while these recent numbers have been encouraging on hospitalizations, positive tests, and some other measures, we're not yet out of the woods, and we should all remember that. And it's important that we continue to stick together and work together. To further support the Commonwealth's response to the coronavirus, earlier today I filed a supplemental budget bill that would authorize approximately $1 billion to cover costs that are related to COVID-19 here in the Commonwealth. These COVID-19 response expenses include PPE purchasing, rate adjustments for essential human service providers, temporary field hospitals and shelters, and the first wide contract tracing program in the country, and a whole bunch of other stuff as well. The bill gives us the leverage that we need to utilize federal financial support, like aid from the Federal Emergency Management Agency, so-called FEMA, which can only reimburse state spending resulting from eligible disaster response activities. The supplemental budget would also ensure that adequate state spending has been authorized to allow the Commonwealth to continue to support our communities until additional federal reimbursements are provided. We anticipate that COVID-19 costs that are not supported by FEMA reimbursement will, to the extent possible, be matched by other available federal revenue resources, including through the recently enacted Federal CARES Act. And we look forward to working with the legislature to get this enacted as soon as possible. I said yesterday that we had distributed over 10 million pieces of personal protective equipment to hospitals, nursing homes, community health centers, cities and towns, first responders, EMTs, and others throughout the Commonwealth. And that includes gowns, masks, ventilators, and other gear. We'll continue to support PPE procurement and production to ensure that our frontline workers have access to the resources that are necessary to keep themselves and others safe. MatTek, who have tapped into the state's MERT program, is an integral part of that mission. Last month, I think people know that Massachusetts was proud to announce the Manufacturing Emergency Response Team to support the state's manufacturers in their efforts to produce supplies for frontline workers and the healthcare system as we fight our way through this pandemic. Paired with over $10 million in funding that was available to manufacturers across the state, companies could apply for grants online for equipment, materials, supplies, workforce training, and other needs. The Mass Life Science Center was among the state entities to contribute to this program, and we're excited that the $40,000 of that program made its way here to Ashland to support MatTech's MERT efforts and contributions. MatTech specializes in cell culture and building human tissue in labs, an expertise that is obviously critical for many important issues in healthcare research and discovery, and also when it comes to testing. A natural fit for the MERT initiative, MatTech is now manufacturing viral transport media and COVID-19 test collection kits. This important shift in their operations to produce viral transport media and COVID-19 test collection kits supports key diagnostic tools for virology labs beyond the Ashland and Massachusetts borders as they facilitate safe transport of samples. Additionally, a few of their tissue model types typically reserved for consumer products like cosmetics and pharmaceuticals can now be used as early screening tools for COVID-19 antiviral research. I'll let CEO Alex Armento speak to the specifics of this incredible work that's being done here each day in a minute, but I would like to highlight one aspect of its commitment to supporting COVID-19 response efforts. Over 6 weeks ago, MatTech pivoted operations in some of its labs to produce hand sanitizer. Hundreds and thousands of liters, hundreds of thousands would be pretty cool too, of hand sanitizer have been donated by the company to local first responders and medical facilities, and they've shipped thousands of liters across the country. Massachusetts organizations and people have proven time and time again that in the face of a crisis, they can find the creativity and imagination to rise to the occasion. And on an average day, the work here at MatTech does include remarkable activity. But what they've been able to do with their operations and production to better serve the COVID-19 response and support frontline workers with PPE and other healthcare researchers with test kits and transport media is truly inspiring. We want to applaud MatTech and the team for their significant contributions as a Massachusetts manufacturer to supporting the collaborative effort of so many to combat this pandemic, and we're especially grateful for your generosity, innovation, and support. I'd now like to turn it over to Alex, who's a bit more qualified than I am, to talk about the science of what they've been doing here in the fight against COVID-19. Alex?
Thank you, Governor Baker. On behalf of us all here at MatTech, welcome. Certainly is a pleasure to have you. My name is Alex Armento, and I am the President and CEO at MatTech. As the Governor alluded to, MatTech is a life science company headquartered here in Ashland, Massachusetts. As cell biologists and tissue culture engineers, our main focus is to produce human tissue models as non-animal testing platforms to reduce, refine, and ultimately replace the need for animals in certain testing applications. Being a small business in the life science industry, we have a unique set of capabilities and the agility required to adapt to changing business conditions. An example of this related to COVID-19 is a project that we initiated with the National Institute of Allergy and Infectious Disease. Within days of the CDC isolating the virus from the first confirmed United States case, MatTech's epi-airway lung model was sent to leading infectious disease experts to begin to gain an understanding of this novel coronavirus. The project is ongoing, and over the last few weeks, we've fast-tracked 2 additional tissue models, models of the nasal and the alveolar tissue, to study the impact on the infection in different regions of the lung. The ingenuity and dedication of our staff here can't go unmentioned. I'm very proud to be a part of an incredible team, and my hat goes off to every one of the individuals in this organization. About 6 weeks ago, we decided to produce hand sanitizer, as the Governor mentioned. Within 20 days, we had secured supplies, we had registered our product with regulators, we'd manufactured and began donating hundreds of liters of sanitizer to dozens of local first responders and healthcare professionals. We have since shipped thousands of those liters across the country to individuals and organizations. Hand sanitizer is available in our online store at mattech.com, and we'll continue to make this product available throughout this public health crisis. As we meet here today at the mile marker number 4 of the historic Boston Marathon course, I remember back a few Mondays ago, Patriots Day is typically a day where more than 30,000 athletes grouped together and run by this building to cheers and applause. But with the streets quiet and bare, it really hit home that this COVID-19 challenge, it is a marathon. It's not a sprint. A marathon that we're all taking on together, and a marathon that we'll all complete together. While we ramp up testing in our Commonwealth and throughout our country, MatTek is dedicated to running this marathon every step of the way as we look forward to doing our duty to support local and state communities as best as we can. I'd like to close by thanking our healthcare professionals and our first responders across this Commonwealth and across our great country. Your acts of duty, your selfless acts of duty and compassion are nothing short of heroic. Thank you.
You guys have questions for Alex? Might as well start while he's standing there.
A little bit about we understand the test kits, but the other portion of what you're doing. You mentioned the viral DNA.
Yeah, so this project is centered around viral transport media and really getting the sample, the nasal sample from the individual to the testing laboratory. And so our aim here is to produce test kits with sterile swabs, a tube, a vial of viral transport media, all in one kit. And so clinicians, healthcare professionals can order these and have them on site and actually conduct the swab test. Put that swab into the tube of viral transport media, it'll be labeled and ship it off to a testing lab.
Is that actively happening now, or are you in the process of producing that?
We've secured all of the supplies and we'll be producing it in the next couple of days.
Tell them how much you think you can produce when you get going.
So we think we can start with a quantity of about 10,000 units per week, and we will be able to scale up from there. We're hoping for between 20 and 30,000 a week.
What kind of a difference would people see when you listen to these numbers and lots of the people at home? What kind of a difference does that make?
In the great scheme of things, I mean, this it sounds like all the states and federal governments are trying to increase testing I mean, I've heard numbers from testing everybody once to 3 times. Every little bit helps, and I think that the governor mentioned there's about 450, 600 companies in Massachusetts that are all helping out with different aspects of this COVID-19 response. And so, I think that there's enough companies out there where all these little pieces will come together to solve a big problem.
Let me just add one thing to the question about what difference it can make. There are basically 3 key elements to testing, okay? At least when it comes to COVID-19. One is the labs to actually process the test, okay? And those labs in them, or doctor's offices or outpatient clinics or hospitals, have machines in them, okay? And the limiting factor to how many tests they can process is the number of machines they have, how fast those machines can process tests, and how many people they have who understand how to actually manage the machines and process the tests and all the rest. And since March, that particular aspect of the testing process has been growing, and there's more and more capacity now to actually process tests than there was when this all began, and there will continue to be growth in capacity to actually to process tests as we move forward. And some of that will happen because people will be able to access more of the machines that can actually do the tests. Some of it's going to happen because people are working on machines that can actually process more tests more quickly than whatever the old version was. That's point number 1. Point number 2 is the actual mechanism through which you collect the specimen. And, honestly, if someone had told me when this whole thing began that accessing swabs, which are basically the mechanism that are used, primarily a nasal swab. We were talking about the fact that at some point we think it'll probably be a nasal swab or a cheek swab. People will get to the point where they do saliva-based testing. The whole issue of swabs has been a real issue. I mean, we've been on a global hunt for swabs in many cases to be able to, as the test capacity side goes up here, to make sure that we have the ability to get swabs for community health centers and hospitals and other providers who are part of our universe that we're trying to help expand their ability to test. And then the third part of this is the transport. The thing you stick the swab into what these folks are talking about making, that then gets the swab from wherever it is the test was, the specimen was collected, to the lab where it can be processed and the results can then be returned. And all three of those issues have been a challenge for states and for nations in some cases in their desire to ramp up their ability to do this. Part of it is because you need a COVID-19 specific processing system. You need a swab that's going to work in the context of what you're trying to do with respect to specimen collection for COVID-19. And you need a transport medium that will also protect and preserve the specimen with the particulars that are associated with COVID-19 testing on the other end. So if these folks can make 20 or 30,000 or 40 or 50,000 or whatever the number ends up being, transport mediums here in Massachusetts that can be available to folks like us and others that are looking to expand testing, and we can keep them here in Massachusetts, that's a huge win for us in the larger context of trying to get from where we're testing now to a higher and more significant level. Because the biggest challenge across PPE testing, many of the issues that are associated with this issue since it got started some 65, 70 days ago, has been creating capacity. And folks are working on the capacity on the machine front, the processing front with respect to tests, and folks are working with respect to capacity on the nasal swabs and the availability of other swabs that will meet the tests and get FDA approved and all the rest. And then the third piece of this is the transport medium. And what these guys are doing with respect to that will be enormously helpful, because all of us believe at the end of the day we're going to do a lot more testing.
Governor, can you provide a little more clarity for the types of businesses that could possibly reopen in phase one? I think there's a lot of uncertainty around that. Can you give us a little more clarity? We're hearing about dentist's office taking appointments, that kind of thing.
Well, I think what we said yesterday continues to be the sort of bottom line, which is the folks that are most likely to be able to operate successfully on the 18th are going to be many of the folks that are currently operating, right? They're essential businesses, but they are going to have to operate under the statewide guidelines and the industry-specific guidelines that will be issued as part of issuing the report on the 18th, all right? And the second group that's likely to come out earliest are going to be people who work in ways and in spaces that don't have a lot of, sort of face-to-face interaction with customers as part of their regular business. And then as you move into the second and third phases or intermediate steps along the way, we'll start to bring the folks who have direct face-to-face contact with customers in and make sure we do it in a way that gives them the time that they need to actually create the infrastructure that's necessary to preserve and protect their employees and their customers.
Are you taking into account the importance of the business, Governor? Because a dentist is face-to-face, so is a haircut, and those are things people really need right now, every single day.
I think that's certainly part of it, but you also want to make sure there are people who can do what needs to be done to do it safely.
So
Yeah.
if you're thinking of dividers and that kind of thing?
I certainly think for some of the industry-specific stuff, you'll definitely, anybody who's been in a CVS, I think, has noticed that in a CVS, all the employees and every customer I've seen in there is wearing a face covering, and they do have plexiglass, the same way most of the supermarkets now do. And I certainly expect you're going to see a lot more of that type of thing.
When will people in phase one know that they are in phase one? Is that going to be on the 18th when the report comes out, or would that be earlier?
I think it'll probably be on the 18th.
Governor, earlier there was testimony, Dr. Fauci meeting two senators, and a senator from Connecticut said that states are unprepared to reopen because of the lack of guidance from the White House, federal government. Has there been any more guidance that you've gotten? What's the latest with that?
So there is the CDC is constantly updating a lot of its guidance on both general guidance and specific guidance on a number of these issues, and we pay a lot of attention to that. And there's an ongoing conversation that goes on between our Department of Public Health and its peers, in other departments of public health. But here in Massachusetts, we also have access to some of the most talented and well-known and well-respected epidemiologists and infection control folks you're going to find anywhere in the country and probably in the world. And several of them have served on our medical advisory board for the command center. And, you know, Rochelle Walensky is world-renowned, and she's serving on the reopening advisory board. So while we certainly rely on and are assisted in our decision-making by federal authorities, we also have a ton of talent right here in Massachusetts that we rely on as well.
Last question.
Mass retailers said yesterday that a lot of businesses, if they're not back by Memorial Day, they're not ever going to come back. What preparations is the state making for those businesses to either go out, or can the state support them somehow?
Well, I think one of the things that's been true from the beginning on this is the states and the federal government have put a variety of measures in place, whether it's the Paycheck Protection Program or some of the loan programs that we've done for smaller business through the Mass Growth Capital Fund. And there's been a tremendous amount of work done to stand up capacity to support the unprecedented number of people who've gone out on unemployment. And we also put in place a variety of measures with respect to evictions and foreclosures so that people during this period of time couldn't be removed from their locations. But it's our hope and our expectation that if we do this right and we phase it appropriately, that people will be able to come back on a reasonable clock. But as we've said from the beginning on this, we're going to continue to pay a lot of attention to the surveillance data that we've talked about when we've been here, not here so much, but at the State House, when we've been doing these daily events where we talk about the information that we're going to continue to track. And it's our goal here. I get the fact that this is, that everybody would like everything to be open sooner, right? The downside to that, and it's an important downside, is you want to do this in a way where you can sustain the opening when you go forward. You have the mechanisms in place to do the testing that are required, and we're going to significantly ramp up our testing capability. Our tracing program, we've already stood up, and they're collecting data and information and providing support and isolation for thousands of people now in Massachusetts is an important part of that. But the other important part of it is making sure that as you put these general guidelines in place and then the industry-specific guidelines in place, that people are going to be able to deliver on them, and that we have the ability to monitor how they do.
Quick question on the SUP, $1 billion, that's a lot of money, where's it going to come from?
So that's $1 billion, but it's actually a net zero to the state. This is the money that we need to appropriate and acknowledge to be able to access federal reimbursements under our Emergency Declaration Act under FEMA. The way FEMA works is, and this is sort of the way it's always worked, is the states spend, the feds reimburse when it comes to FEMA stuff. And for us to access what we believe is the very significant amount of resource that the federal government, through the emergency declaration, has signed up to reimburse us for, we need to spend first to get them to reimburse us. And that's basically what that is.
Are you anticipating the stay-at-home advisory will end Monday? A lot of people are asking about that.
I think on all of those various issues that people have questions about, we're going to talk about all of those on Monday.
Thanks, guys.
The day they expire?
Yeah.
Is there anything business owners can do now, though, as they wait to find out which phase they're in? Should they call back their staff? Should they, what can you tell them?
Well, the first thing they should do is take a look at those global standards and see how they think they would do against those. I mean, part of the reason we put those out was to make clear that there's going to be a standard that everybody has to abide by and comply to.
Thanks, everybody.
Thanks. Thank you again.